Good evening. Invercargill's main shopping street has been given the go-ahead for a $1.4 million makeover. Invercargill City Council have given the project the green light and increased the original budget following public consultation. An additional $267,000 has been allocated for extra items identified during the consultation process, including extra gardens, festive light poles, a water feature, increased canopy size and more paved areas. The Inner City Working Group agreed significant savings could be made in future stages to compensate for additional costs in this first stage, which covers from the Pocket Park to D Street. Work's scheduled to start mid-January and will take approximately 4 months to complete. And another budget has been approved by Council for the South City redevelopment. Preparations can now be made to improve the streetscape for South City, but at an increased price. The original budget produced in 2012 of $815,000 has been increased and approved at $960,000. Part of the cost differential occurred following public consultation over plans for the area and work being tendered, increasing costs to over $1.2 million. The South Alive executive have since identified areas where savings could be made in order to bring the project in closer to budget. Plan changes and project timing are yet to be confirmed. After considering the serious nature, circumstances and evidence of the 3-dog attack that injured a woman and killed her dog in Riverton recently, the Southland District Council have decided prosecution's appropriate and have laid charges under Section 57 of the Dog Control Act against the 2 dog owners. The move to prosecute comes at a time when the Council's dog control policy and bylaw are under review.
Well, in this case, it's a maximum $3,000 fine. The judge does have the authority to order the destruction of the dogs, but in this case that doesn't apply because they've already been destroyed. If both are convicted, a further option for council is disqualification. Now in this case one of the owners was already disqualified, so the other owner also may face disqualification if we feel it's warranted.
You are working on the dog control policy to try and tighten up on some of these situations. Can you take us through some of the ideas that you're putting forward for that?
Yes, we've decided to review the policy and the bylaw. We feel that there are certain strategies that council could implement that may reduce aggression and wandering in the district. We're looking at a responsible ownership fee category, as we do recognise that responsible owners do not create a demand on dog control services, therefore they should only be paying a base fee. We're looking at an incentive to neuter also in the fees and charges. We feel that neutering could have certain advantages. Again, a reduction of aggression over the whole population, reduction of wandering. Also, other benefits like certain breeds of dogs not breeding, such as the American Pit Bull Terriers, which we do have a number of. Another one would be a licence to keep more than a certain number of dogs, perhaps 3 at this point. An interesting comparison was at the last council meeting we heard 3 objections to attacks. One attack involved 1 dog, 1 attack involved 2 dogs, and 1 attack involved 3 dogs, and the severity of the incident was proportional to the number of dogs. So we feel that, for example, there's somebody out there with 5 Rottweilers on an urban property. That person needs to be controlling those dogs very well to ensure the safety of the neighbourhood.
What stage is this process at the moment?
Council has approved the review, and it's also approved public feedback to be sought. So we're looking at doing the public feedback early in the new year. Once that's received, then we'll be in a position to write a draft, and then that again will go out for public feedback after that. Also, we're looking at working with the Invercargill and Gore councils. We're quite keen to get uniformity across the region if possible.
Encouraging public to continue being vigilant is essential in fighting crime in the south, and so is educating people in positions where they could come face to face with robbers. I spoke to Mike Bowman of the Invercargill Police today, who said public information sharing and excellent detective work are proving to be a winning combination when it comes to solving robbery and burglary crimes in the south.
It was good police work, but it was also good interaction with the community as well, who provided some valuable information as well, so it was a good result.
It was the investigation that was part of the Otatara incident, was it purely from people that weren't on the scene that you've managed to catch this guy? No,
it was a bit of everything really. We had CCTV footage from the premises. We had the tenants that were involved in it, the neighbours. So it was a lot of people involved in the information gathering.
And as far as the 2 men in the Crinna Street dairy?
Likewise, it was just a bit of everything really.
The CCTV footage is quite crucial in cases like this. How many premises do you know that in that susceptible range would have that kind of footage?
A lot of the dairies and garages have it, but I would certainly stress to premises that are sort of vulnerable, potentially vulnerable, who haven't got it, to really consider doing it, getting it installed. I think the good guide is COOP, which is keep calm. Obey all the instructions of the offender so you don't get hurt. Observe everything you can about the offender, and then after they've left, preserve the evidence. So that's a good guide for them really.
Historically, there's been a number of burglaries and robberies in the city, but really good success rate overall with the police. Yes,
you might have read in the paper today there was outlined a large number of robberies since about 2008. But what the article didn't say is that nearly all of them, apart from a couple from my recollection, have been solved. So even though we've had a large number since 2008, it's good police work have resulted in offenders being apprehended.
And perhaps a deterrent for potential offenders?
Well, we'd like to think so, and particularly after the weekend's efforts, it shows that with the cooperation of the public, we can solve these really quickly.
Stay with us after the break. There's plenty of reaction to a proposed air quality plan for the South, plus Stoptober success. Welcome back. Hundreds of submissions have been received on the air plan review and proposed rules to help improve Southland's air quality. Submissions closed yesterday, but final numbers won't be known until later in the week. Submissions have come in a variety of formats, with many people making several submissions on multiple points on the proposed rules, which include the phasing out of multi-fuel burners and open fires over coming years. Chimney smoke is the major cause of air pollution within Invercargill and Gore airsheds, particularly in winter months. Environment Southland is legally required to address air quality problems to meet government's health-inspired national environmental standards for air quality. Being prepared to support the health of our ageing population and consideration of the negligent population increase across the district are two key factors Southlanders should consider when submitting on the Southern District Health Board's Strategic Health Plan, currently in its draft. A series of meetings are being held in the South over the coming weeks to gauge public feedback. In Invercargill today at Hui at Mirahiku Marae was held as part of the consultation on the plan, which builds on what's known about community health and takes into account the people, facilities, skills and resources available. SDHB Program Director and former surgeon Pim Allen says it's all about the big picture and what the region is facing with ageing population.
So it's fine to have a plan, but actually everybody needs to see.
I think across the whole district we're facing a fundamental issue, which is we're getting older as a population. That brings more complex conditions and more of them, so people don't just have arthritis, they have diabetes and high blood pressure. That complicates the condition, it also complicates the treatment. So across the population, irrespective of where people are living, with possibly the exception of Queenstown, the population is ageing. The challenge we have, though, in the District Health Board is the population as a whole isn't growing very much, a small amount but not much. So people are moving within the district but not coming into the district. And what that means is that the funding we have, which is based on the population, isn't going to change very much. And so that's why we need to look at what we're going to do in the future so that we can meet the needs, the clinical needs that people have within the resources that we've got. I'm sure we can do that. I'm sure we can do things differently. But it does mean the status quo isn't going to be enough. It's not going to be satisfactory.
So you're looking for more efficiencies to deliver as good as service, if not better?
Efficiencies and a lot of other things. So what we're talking about is sustainability. How do we have a service that's sustainable into the longer term? Yes, it's no surprise to everybody that the District Health Board's got some financial problems. That's been so for a very long time. But that's not the fundamental driver behind this. It's much more about we're here for a very specific reason, to serve our population, to maintain health and improve health outcomes and to improve access. How are we going to do that since we know what population is coming towards us very quickly and within the resources we've got.
And you talk about quick turnaround for a lot of surgical procedures now these days. However, with the ageing population, you've got a lot more geriatric hospitalisation care potentially going forward with layers of health issues. Yeah. Is it perhaps going to end up balancing itself out at the end of the day anyway?
One of the things if we compare what the District Health Board here is using in terms of resources compared with the rest of New Zealand, we stand out in a number of places, and one of those is aged residential care. So we have more people in aged residential care earlier than some other districts do. Now, we don't know why that is. There might be very good reasons for that, but we do need to understand what that means. But the aim, really, of good contemporary healthcare is to keep people well and at home for as long as possible. So it does mean changing the way the system works, moving resources as necessary closer to people's homes so that they can be supported there, and then figuring out what the best overall pattern is. Maybe one of the key parts of the consultation, though, is that this is not just about the District Health Board. It's not just about Southland and Otago, so it's the whole of the district, and it's all of the health providers and actually all of us needing to understand what this is all about, because in the end most healthcare occurs in people's own communities, in their own homes, and so we have a personal responsibility to protect our own health and do the right thing. We then work with community providers and GPs to protect that and manage simple things.
Thousands of smokers stubbed out their cigarettes during Stoptober, New Zealand's first national quit smoking month. Around 5,100 smokers signed up to give up, and many more have gone it alone. Clinical evidence shows smokers who manage to stop smoking for more than a month are 5 times more likely to stop for good. Over half the quitters were aged between 25 and 44, and twice as many females committed to stop compared to males. Financial and health were primarily the motivators, as well as longevity of life. Smoking remains the biggest cause of premature death in New Zealand, taking 5,000 lives each year, which equates to 13 people per day. Sport follows the weather, which is up next from the news team. Good night.